Hello, my name is Marie Budev. I'm the medical director of the Lung and Heart-Lung Transplant Program at the Cleveland Clinic, and I'm presently the chair of the OPTN Lung Committee. What we know to expect is that the number of patients that are on the waiting list, there will be a reduce in death of patients dying while waiting for organs. In addition, there'll be an increase in access to patients for transplantation, especially those patients that are sickest or medically urgent, patients that are under the age of 18 or pediatric, patients that have been prior living donors of liver or kidneys, patients who are shorter in size, or if patients are sensitized or harder to match because their immune system is limiting the number of donors available to them in the donor pool. And if you're expected to live longer after your transplant, this is referred to as post-transplant survival, this is a patient that we hope will do better within this system. So this policy was developed with extensive transplant community input, which included patient input on factors that they thought was the most important in determining how to place lungs and match lungs. The OPTN committee actually deliberated about this for several years. We had several simulation models that were in place and mathematical optimization that took place on this exercise to develop this policy. There also will be continued opportunities for patients in the transplant community to provide input on any future changes to the lung allocation. So we're always asking for continuous patient feedback as continuous distribution goes into effect. What you have to say is very important, and we're listening. The fact that continuous distribution is patient-centered and it's very flexible and changes can happen, this is really important. So if we see trends that are noted on the monitoring reports, this is something that we can change and address. This strengthens this allocation system. Also, it's really important that continuous distribution, that you know that it's points-based and it's not based on this classification. It allows for incorporation of new patient factors. It's another strength of this system.